064 Noah. It's a health project run by Jocelyn Walker. Jocelyn Walker, yeah. You, Jocelyn Walker. Hello, welcome from Gauteng. Over to you.
Will somebody take the ugly? Will somebody take your ugly walk away here?
Yeah.
Yes, Lord.
We're low-tech.
Good day, everyone. I'm the communications manager who run NOAA. NOAA is at its heart a community-based and community-driven program working with orphan and vulnerable children in the provinces of KwaZulu-Natal and Gauteng. We're working in 101 projects now, having recently pledged as independent projects 4 projects to be funded directly by government. This is at the heart of our model. We act as almost an incubator, setting up the projects by creating partnerships with corporates who like to build resource centres and provide funds for training and development. After the projects have gone through a 4 to 5 year process, it's a 4-phase developmental process, we prepare them for independence, where they are set up as independent CEOs. We work very closely with the Departments of Social Development, and our goal is for the department to take on these projects as ongoing welfare projects funded by government, because at the end of the day, they're caring for orphan and vulnerable children. The services we provide at our projects, which we call ARCs, range from educational support through early childhood development and aftercare, homework supervision, computer literacy, through to health support, where we work closely with clinics and make a lot of clinic referrals and health referrals. The sustainability lies in the training and capacity building that we provide to the community members. This empowers them to care for their own orphan and vulnerable children. With 3.7 million orphan children in this country right now, we cannot build orphanages for them, we cannot institutionalize them. We have to rely on the system that is already working, which is the extended family. NOAA goes in and provides layers of support, if you can envisage an onion, around the OVC. The child is first strengthened in their home through economic support, helping them get government grants for childcare or foster care grants or pensions, helping them secure identity documentation, school fee exemption, those kinds of things. We then bring in a community around them in the form of our committees and volunteers. These are people who dedicate their lives to making sure that these children are looked after, both in terms of health and economics. We bring in teachers and perhaps the clergy or local councillors from that area or local traditional leadership. Our next layer of support comes to a regional and provincial level, where local businesses from a province, for example, will fund or offer volunteer services to that community and to that child. We bring in national support and finally international support. Each one of these trying to meet the objectives around educational, psychosocial, health, child protection, and nutritional food security for the child. We work through our amazing volunteers and communities. We have over 500, I think it's 516 volunteers currently, and over 800 committee members working with the 27,000 odd children within the NOAA network. For us, it's about making an immediate and long-term impact. And I'd like to share with you 3 stories directly from the communities, because I could talk all day about what we do, but really it's the children's words that make the most impact. My name is Sandile Ngubeni. I'm 14 years old. I'm a boy. I'm doing grade 6. I live with my grandmother and my 7 siblings. I would like to say thank you for our cosmetics pack. Since I was a child, we always share the face cloths, the combs, and even the toothbrushes. This is my first time to have my own set. I feel good. I will take very good care of it. This is one of the 2,500 children that we were able to distribute a cosmetics or a health pack to. This child had never had his own toothbrush. It made an immediate impact in his life, made him feel a whole lot better about himself, and will therefore help him develop some emotional strength and help him to deal with the struggles that are going to lie ahead for him. I'd like now to take you to one of our projects in northern KwaZulu-Natal near Phinda Game Reserve. A child at Impumelelo school had not come to school for a few days. The teachers came to the Ark and said, do you know this boy? He hasn't come, we don't know anything about him, where he lives, what do you know? And the volunteers at the Ark said, we know of his family, but he's not registered with us, but don't worry, we'll pay him a home visit. Because when they got to his house, they found that he was at home and his mother had passed away. Because he'd been told not to tell anyone his mom was sick, and he'd been told that it was very bad to talk about his mother's illness, he was too afraid to tell anyone she passed away. He therefore stayed at home with her body. At the time it was summer, the river that separated him from his grandmother was in flood, so he couldn't even tell his grandmother, the one person who he could trust. The Ark swung into action, brought their resources together, contacted the Departments of Home Affairs and Social Development, secured a grant, got this child to his grandmother, and I'm really happy to say 2 years later he's doing well in school, he's getting constant emotional support throughout psychosocial counselling, bereavement counselling, trauma support, helped build a memory box around his mother and really cemented himself. This is what is sustainable. Teaching these children that they're not alone, teaching them that they have a community that they can turn to. By 2015, 10% of our workforce is going to be made up of adults who are orphaned as children. They can grow up neglected, angry, and lost. Or they can grow up knowing community support, strength, empathy, and love. That's what we provide at our Arks. The final story I'll share with you is a girl from Kumashu. At 12 years of age, she lost her mother. She went to go live with her grandmother, and shortly thereafter, a Ark started in her community. At the age of 14, she started going to this Ark. She was just entering high school, and the Ark staff noted that she was quite gifted. She was very intelligent, academically doing very well. At a school in Kumashu, they didn't have a science lab, they didn't have a lot of support for her. So they linked her up with one of our partners through the US consular office, and she started attending tutorials and extra lessons at a college in Durban. By the time she was 18, this girl got 8 distinctions at the end of matric. She's now studying in the US doing her medical degree. This shows you the levels of support that we can go to, from right in the community with the local leadership and your local teachers, through to an international community that brings in support and resources to the community. Each of these stories illustrate how our network of care works and how it acts on individuals through community interventions. We are not about a single individual. We are about a strategic, community-driven program. It doesn't work one of us doing anything. We all have to get together. We recently put together our strategic plan that takes us through to the next 5 years. Part of this is based on our community model, and the idea being that each of these independent Arks will form their own CBO, allowing NOAA to move from that community into a new community, spreading our model